Learn how to heal faster. Welcome to episode 67 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix online low back program. And today's topic is how to heal faster with low back issues. If you missed our last episode, episode 66, we discussed all about the sciatica stretches that you should not be doing. And we explained in depth on nerve tension, disc pressure, so that you can understand the type of exercises and stretches that you should probably not be doing right now, and instead focus on the ones that are going to help you in the long run. Now, today's topic is going to help you learn how to heal faster from low back issues. Low back issues are the number one disability in the world, and 80% of people alive will experience low back pain at some point, and you are probably listening to this because you are dealing with low back issues. Whether it's constant, whether it's on and off for the last few years, or whether you just want to learn more about back issues to try to prevent them from occurring in the future, which is a very wise choice, being proactive about your health. Now, when many people have these low back flare-ups, let's say it's your first flare-up. If this is a recurring flare-up, if you're flaring up routinely, once a week, once a month, even a few times a year, all right, it's obvious whatever you've been doing has not been working, and it's time to try something different. And perhaps this episode will help you. But once again, if it's just recurring over and over, yes, I'm going to teach you how to recover faster from these, but you got to do something else. You need a serious plan. Get with an expert, get with us, let us help you go through it, okay? Don't go through it on your own. But let's just say you have infrequent recurrences, or you're someone who wants to be prepared for if it ever does happen. Here's how you can get over these flare-ups faster and heal faster. So when many people have an acute bout of low back pain or a sciatica, many times they want to stay stagnant because they're in pain. Oh, let me lay in bed for a few days. They don't want to move. It is well documented that someone with an acute bout of lower back pain, if they are stagnant and they're not moving, that actually increases stiffness and it reduces rate of healing. Movement is medicine, and there's many benefits associated with movement, especially with lower back issues. And the more you move and the more you maintain common activities, which is a separate category of its own, the more you're going to heal. Why? Because movement of joints is good. It increases synovial fluid production. It increases mechanoreceptor stimulation, which is really great for our brain and for our body, for our awareness, and for our joints. It increases fluid movement throughout the entire body, our lymphatic system, right? It doesn't improve. It causes muscle movement and muscle activation, just simply moving around. We want our muscles getting blood flow and moving around the area of concern. And also moving just simply will help take your mind off of your lower back and make you not as obsessed or focused or anxious about your lower back. So simply moving has so many healing effects in and on its own, and is very well documented as something that you should continue to do. Maintaining normal activities is another category, obviously related to movement as well. But if immediately you're modifying your entire life because you just hurt your lower back, that can lead to fear avoidance behaviors. Essentially, immediately avoiding things that you're fearful are going to cause pain. This can cause learned behaviors such as just, subconsciously starting to avoid certain activities because you're expecting the onset of pain. This will rewire your brain to feeling pain with those very activities. If you think that every time you do something, you're going to feel pain and you have that wired in your brain, you're never going to want to do it. And you're always going to be afraid of that. And you're going to have a fear avoidance behavior. And maybe if you do ever go to do that, your body's going to immediately trigger a pain response because it's learned that. It's very similar to if, let's say, every time you go in the kitchen, you touch the stovetop, and the stovetop is always on. It's burning hot, and you can't tell that because it's just the same color as the rest of the stovetop. So you touch it, burns your hand. Touch it, burns your hand. This goes on for a few months. All of a sudden, someday, it's not on. You touch it, you're going to react as if it's on. You're going to go, oh my gosh, my hand. You're going to react the same way because it's a learned behavior, and you're going to feel pain too. Your brain will trigger a pain response. This is why we want to maintain normal activities. Now, also for many people, when they get sick and laid up in bed, or they don't feel good, such as with lower back pain, They resort to comfort foods and a sort of diet that will release endorphins. They start to look for relief in different ways. So they're going to look for sugar rushes, endorphins, tasty foods, and they're going to go away from cleaner eating to inflammatory based eating. So they're going to start to consume a lot of sugars, a lot of grains, a lot of flours, and not enough nutrients to promote a healing environment. In fact, the quite opposite. Eating this way will promote an anti-healing environment. It is well known that flours, breads, grains, sugars promote an anti-healing environment and make it more difficult for your body to heal. That is not going to be helpful for lower back issues. And we've even had some clients who found incredible improvement throughout our program, but there was just a little bit left over that they couldn't fully resolve. And the second they went gluten-free, they were able to get that extra little bit of recovery. Now, one more thing you might want to consider is that with sugar, with an overconsumption of sugar, we know that diabetics have poor wound healing, right? Because their blood sugar is out of control. Well, if we're eating a whole bunch of sugar all of a sudden, then doesn't it make sense that we're not going to have good wound healing abilities, just like a diabetic would? Now, I know that we might not have the same, blood sugar fluctuations as someone with actual clinical diabetes, but consider the same concept, right? If having unstable or high levels of blood sugar are decreasing wound healing because individuals have diabetic ulcers, it makes sense that if you're eating a whole bunch of sugar and increasing your blood sugar, it's not going to be good for any other kind of healing. So it's not something you want to do. And also, increasing consumption of sugar and grains and flours and all these things will decrease your water intake too. This is also documented. Your water intake will reduce. So we want high hydration levels for proper nutrient flow and lymphatic drainage, and for all these things that are also involved with wound healing. So these simple practices can go a very, very long way, both in your diet, in your movement, and in your mindset for how to recover from lower back issues. Ultimately, we just don't want you to be afraid of lower back pain. Lower back pain is very, very common, but it creates a lot of fear because there's a lot of uncertainty and misunderstanding around it. And we want to show you a more realistic outlook on how to approach these scenarios so that you can be ready for when it happens or if it happens or whatever type of scenario you're in. And this is something that we deal with all of the time. The types of lower back issues where the longer you sit, the more you feel it, bending over to put socks and shoes on. If you're sitting for a long time, it's hard to stand up straight and it's hard to even lean backwards, or any kind of sciatica down the leg. These are very, very, very common issues. And we don't want you to feel alone in these because we have a whole community of individuals who are struggling with this on our private Facebook group called RehabFix Low Back Program. Please join this Facebook group so we can help you with more information on ways that you can continue to heal faster, not only in the ways that we discussed today, but additional guides that we have available to talk you through the process that we take many individuals with sciatica or lower back pain through. And just by joining our Facebook group, you will automatically be tagged in these guides so that you can learn how to fix yourself and be guided through low back pain recovery. If you are watching on YouTube, please like, comment, and subscribe. If you're listening on your favorite podcast platform, please leave a 5-star rating and review. This greatly helps the podcast grow, and it is a zero-cost way for you to give back. It takes you 30 seconds. Please just go to the Apple app, scroll all the way down on our podcast to write a review, leave a 5-star review. It takes you 30 seconds to do this, and it would greatly, greatly help. As always, move more, move in nature, move in the sun. Thank you so much for listening, and have a great day.